This short video focuses on learning from transfusion-related deaths reported to SHOT. Transfusions are generally safe, but risks still exist. When adverse events including patient deaths occur, it is crucial to identify preventable factors and learn from these events to improve safety. We will explore recurring themes, contributory factors, and critical steps in transfusion pathways that impact patient safety. Analysing these events can lead to valuable insights and help prevent future errors, improve practices, and enhance care for patients. This chart shows the distribution of these deaths in 2023 based on the likelihood that they were related to the transfusion. In 2023, there were 38 cases of transfusion-related deaths, with pulmonary complications and delays making up over 75% of these cases. Transfusion-associated circulatory overload, or TACO, made up most of the pulmonary complications reported. The rise in reports of transfusion delays and pulmonary complications led to 2 UK-wide safety alerts being released. In 2022, an alert focused on preventing delays in bleeding and critically anemic patients. And in 2024, a second alert aimed to reduce risks of TACO. These alerts outline improvement actions for healthcare providers to enhance patient safety. Let's look at 2 example cases to identify contributing factors and find ways to improve transfusion safety. A low body weight female patient with a low hemoglobin of 68 grams per litre was prescribed 2 units of red cells. She had liver disease and sepsis with peripheral edema. The cause of the anemia was not clear, but she was not actively bleeding and had no cardiovascular compromise. A TACO pre-transfusion risk assessment was completed, but the risks were not identified and no preventative actions were taken. The first unit of red cells was given without issue. The second unit was started 4 hours later without a clinical review. The patient became acutely unwell and an emergency call was made. She developed breathing difficulties with oxygen desaturation and increased heart rate and blood pressure. A chest X-ray showed pulmonary edema. A fluid balance was not reported, but there had been a 5-kilogram increase in weight post-transfusion. Despite treatment, her condition did not improve. She was admitted to ICU where the patient sadly passed away. This case highlights missed opportunities to identify TACO risks and implement mitigating factors, which led to patient death. The contributory factors included TACO risks were not identified, no review between transfusions, fluid balance was not monitored, transfusion occurred out of hours, not using a single unit red cell transfusion approach. What can we learn from this to enhance patient safety? Ensure TACO risk assessment is completed appropriately by trained staff for each transfusion episode. Identify risks and mitigate them with appropriate actions. Recognize that risks can't be completely eliminated, so close monitoring is essential. Use structured investigation tools to optimize learning from TACO incidents. TACO prevention and mitigation measures include prophylactic diuretics, measuring fluid balance, single unit transfusion with review, dosing based on body weight, monitoring vital signs, and considering alternatives to transfusion. In another case, a patient had a perforated duodenal ulcer and was in a COVID bay. The team recognized the need for urgent transfusion, but were unfamiliar with the management of major hemorrhage and did not correctly activate the major hemorrhage protocol, or MHP. Instead, a doctor told a nurse not involved with the patient to urgently get blood, causing confusion with the laboratory staff. Unfamiliarity with the protocol and rare occurrence of such cases in that area delayed action and contributed to the patient's death. The contributory factors included poor communication between clinical teams and the transfusion laboratory, staff unfamiliarity with activating the major hemorrhage protocol, gaps in knowledge about collecting emergency red cell units. What can we learn from this to improve patient safety? Make the protocol easy to find and simple to follow. Conduct local drills and simulations involving all staff in the transfusion process. Improve communication across the transfusion pathway. Include transfusion laboratory in protocol activation. clearly specify urgent blood requests, who it's for, what's needed, where, and when. Debrief after protocol activations to identify successes and areas for improvement. Transfusion incidents reported to SHOT often stem from inadequate systems, processes, and conditions. Learning from deaths to improve systems and enhance safety is vital. For this to happen, we need to ensure a patient-centered approach, including family and carers, systematic and multidisciplinary reviews, focus on systemic issues and not individual blame. Prioritize addressing preventable factors in any reported deaths, transparent reporting, data-driven and evidence-based learning, psychological safety and staff support, continuous learning and improvement, and sharing learning widely. Learning from patient deaths is vital. Prioritizing this learning reduces preventable deaths and fosters a culture of continuous improvement, transparency, and patient safety. The goal is to translate lessons from the tragic events into better future care. A just restorative culture encourages staff and patients to voice concerns openly. Investigating incidents with a focus on human factors helps identify contributory factors and improvement actions. Sharing the learning from these events widely can prevent future patient harm. Remember, complete safety checks. Communicate effectively and consolidate learning to improve patient safety.